So my name's Caroline Tweedie. I've been a clinical nurse specialist in breast care for 17 years. Now, there's risks with breast cancer that there's nothing you can do about, and three of the main ones is being a woman, getting older, and your genetics. Can't do anything about them. But there's a couple of other lifestyle risks that we can control. Two of the main ones being obesity and alcohol. Probably the worst part of my job is to sit down a woman with a family and tell her that just got cancer. And people never ever forget those words, you have cancer. Nobody ever prepares for those words. And, you know, for us, it's like handing over a grenade and lives just implode. 1 in 10 of diagnoses that we see is down to alcohol intake. I mean, just in this department alone, that would be 70 cancers less we would see every year. I think people would be shocked to know that alcohol is that group 1 carcinogen, you know, alongside things, you know, as toxic as asbestos and smoking, you know, because it causes 7 different types of cancer. And when we ingest alcohol, that drop in dopamine and serotonin, which are already quite low when you're going through things like menopause, can cause horrendous things like depression, anxiety. It also ramps up the cortisol in our bodies. And what that essentially does is when we've drank and those really high cortisol levels, it interrupts sleep. And that sleep interruption can go on for about 2 days. And when we don't get enough sleep, there's another hormone that then comes into action, which is called ghrelin, which again then increases our appetite. So you can see why there's such a big link between drinking and becoming obese as well, which again, what people don't realise is another cause of breast cancer is that increase in hormones. If more women knew, they wouldn't have that peer pressure. It's extremely strong and it's extremely difficult to say, you know, I'm not having that extra drink. And I think if women, you know, united and understood the damage that they were doing in the body and the risks that they were doing in the body, they might be a bit more supportive of one another, of maybe, you know, stepping back and saying, that's all right if you don't want to have a drink. You know, we support one another and maybe inspire one another to kind of look at how much they're drinking and drinking, you know, just that little bit less to reap the benefits.